Well, hey, everybody. Hey, everybody. Hope you're doing good. Just wanted to do a little recording here today to go over the summary of benefits for the Honor Plan. That is the Humana 2022 Honor Plan. It's a plan designed for medical benefits only. It doesn't cover drugs. So you may have your drug coverage from Champion Paper Mill, the state of North Carolina for your drug coverage, some other retirement plan that covers your drugs, or you may just not have a Part D drug coverage at all, just because that you want to pay for your own drugs, you don't take any drugs, or you were military, TRICARE, VA, Champ VA, any of those circumstances that you have other drug coverages, this is the plan for you. So we want to go over specific benefits with you. This will take a few minutes to roll through. So I'm going to actually share the screen here and bring up the summary of benefits, and we'll kind of roll along. You'll have a copy of all of this so you can look at it. This is a Humana plan. It's a regional plan, so it works anywhere in the country, but it's sold to people who live in North Carolina and Virginia in any county. So that's the basics. Going to cover several things and scroll through here. So let's talk about Humana Regional PPO. It is a PPO. It is not an HMO. It's a PPO, so you can go in or out of network. But of course, the Humana network is very vast all over North Carolina, particularly if you live in Western North Carolina. It'd be very hard to find a doctor who doesn't take the Humana PPO plan. So you have to have Medicare A and B and live within North Carolina or Virginia to take this plan. So it's called the Regional R1390-003 plan. So open enrollment is October 15 through December 7 of 2021 to get this plan. So let's go over some basics. First of all, there's no premium. You can see right here, hopefully you can follow along. You see my cursor, no premium for this plan. But what's really exciting is your plan will reduce your monthly Part B premium by $50. It says up to, but it's actually in North Carolina, $50. What does that mean? They take $148.50 as the standard deduction out of your Social Security check every month from Medicare Part B. Everyone on Medicare has to pay that unless it's paid for by the state, but that's the standard deduction. But when you sign up for this plan, they reduce that by $50, essentially meaning they will take $98.50 out. Now, that's the 2021 figure for Part B Medicare. I'm sure for 22, it'll go up a little bit. Regardless if it goes up a few dollars, the $50 will be subtracted. So essentially, you're going to get a $50 per month pay raise for all of 2022. That's $600 a year. That's pretty exciting. The plan does not have a deductible, has a maximum out-of-pocket liability of $7,550 in the network or $10,000 out of network. Of course, like I said, there's very few doctors that don't take this plan, so finding an out-of-network doctor would actually be pretty hard. So looking at the $7,500.50 out-of-network max out-of-pocket, that means the most you have to pay in a year. That's not a deductible. That means the cap, the most. And nationwide, probably 4 to 5% of people ever even reach that. So typically, it's not even a concern for most people. What's good news is, though, Medicare has no maximum out of pocket. So if you didn't have this plan, your 20% that you would be liable for chemotherapy or different types of outpatient surgery or procedures, the 20% is unlimited with Medicare. So at least there is a cap on this. So you won't go financially destitute. That's a good thing. So let's go over the copays. Inpatient, $395 a day for the first 5 days. That covers everything. Doctor, hospital, room and board, intensive care, surgeon, anesthesiologist. Everything's covered for that $395 per day. After that, there's no copay. Okay, so that's a pretty good result. So even if the bill would be $500,000, you pay $395 a day max. Pretty cool. Outpatient surgery at a hospital, $395. Outpatient at an ambulatory surgical center, that would be a freestanding surgery center like your doctor's office, $345. Doctor visits are $20 and specialist visits are $50. That was the same as last year. Most of this is the same as last year. You might also notice here that it says you do not need a referral to go to plan providers. In other words, you don't have to go to your doctor and get a referral to go to a specialist. You can go straight to the specialist of your choosing. And so that's pretty good. Preventative care, a ton of preventive care. Most of this is cancer screening, bone density, breast cancer screening, cardiovascular screening, HIV screening, obesity screening and counseling, prostate tests. There's just on and on different things. Your flu shots, your corona shot is also included. All this preventative stuff covered for you at zero cost to you. If you go to the emergency room, it's $90. If you're admitted to the hospital within 24 hours, they waive the $90. If you have urgent care, it's $20 copay at the urgent care center. Then you've got outpatient diagnostic services and imaging like CAT scans, MRIs, mammographies, lab services. And you can see various amounts. Usually if it says 50 to 75, let's just err on the safe side and say it's going to be 75, 275 for radiology. That could be potentially like an MRI. Lab services, zero if you go to your doctor's office and they don't use the hospital, $50 if it goes through the hospital. So we always encourage people to use Quest Diagnostics or LabCorp because your lab work in the case would be zero. Diagnostic tests and procedures, x-rays, radiation therapy, $50 copay or 20%. Medicare covered hearing test, $50. Let's continue on. Routine hearing exams, zero for a routine hearing exam. Now people say, does this cover hearing aids? The answer is yes, but you can see here $699 for advanced level hearing aid or $999 for premium level hearing aid. What does that mean? It means if you're looking at the whole vast array of hearing aids out there, it's going to cover a little bit on the lowest, pretty much the low end model of hearing aids. I know that very close person to me, my own dad, went to get hearing aids. He wanted some pretty nice hearing aids that would go Bluetooth with his phone. Wasn't covered at all because it wasn't that basically the entry model. So I never make a big deal about hearing aids. You see a lot of TV commercials making a big deal about hearing aids. I personally don't make a big deal about hearing aids. I do know people have gotten hearing aids from Humana for these copays, and they've saved a lot of money, but it may not be the best fit for you if you want something a little pricier or a little more sophisticated, let's say. But it includes batteries if you get that type of hearing aid. Let's look at the dental. This dental 171, you'll see on the back of the card, says DEN 171. Medicare doesn't cover dental, but this plan covers up to $2,000. This is listing out all the different things: x-rays, dentures, x-rays, root canals, once per year, crowns, fillings, all these kind of extractions, things. And here's your thing: $2,000 combined maximum coverage per year for comprehensive and preventative dental benefits. $2,000 a year. Is there a network? Yes. Do you have to use the network? No. You don't have to stay in the network. If you go to an in-network doctor, it's going to pay a little higher percentage than if you go to an out-of-network doctor. But there are honestly not many dentists in the network in North Carolina, particularly Western North Carolina. And most people really don't want to change their dentist. So here's how we look at it. If it paid $500 on your $1,000 bill, hey, that's $500 that you didn't have. You're not paying for this benefit. So we look at the glass as half full versus without this plan, your glass is completely empty. You pay the whole bill. Does that make sense? So up to $2,000 of coverage for your dental. Vision services, $50 copay. A diabetic exam, glaucoma, Medicare covered. Eyewear after cataract surgery, zero copay. But again, that's going to be limited to a certain amount. Not going to get the transition, super fancy titanium, frames and everything. You're not going to get the best of the best for free. You're going to get a certain, again, Medicare doesn't cover that much on glasses, but they do cover one pair after cataract surgery. The routine vision exam is covered. And look at this, $300 for glasses or contacts per year, $300. Now there is a network, it's called iMed. If you don't have a doctor in your area that takes the iMed network, like Lens Crafters in Asheville takes the iMed network, not a lot of doctors do, but there is a form you can call and ask us for that we can give you for an out-of-network provider, and you can still get your $300. So call us and ask us for that form. Mental health services, $395 a day for the first 4 days if you are needed to go to mental health services inpatient. Group and individual therapy sessions, $40 to $100 copay for those. Skilled nursing facility, this is not long-term care. This is for rehab. Most people are in and out of a rehab center when they maybe get a knee replaced or something in a week or 2 or 3. The first 20 days you pay zero. The next 21 through 60 days you pay $188 copay per day. It is, of course, subject to the out-of-pocket maximum, which Medicare doesn't have, remember, an out-of-pocket maximum. And Medicare's copay per day for 2022, I'm not sure what it is, but it's about the same as this one, $188 for days 21 through 61. Although Medicare's days 21 through 100. So you'll see this is a little better than that. Physical therapy, $10 to $40. Again, that depends if you're going to something in the hospital or part of a hospital system versus a freestanding, not part of a hospital system. It's going to be probably the $10 instead of the $40. Ambulance, $290 per date of service. This includes, this is my understanding that in 2022, this includes an air ambulance helicopter. So that's great right there. Zero copay for 24 one-way trips to the doctor. Okay, now you say one-way trips. Well, it's 24 one-way or 12 round trips to the doctor. You call the number on your ID card. They'll get a car to come pick you up. You may say, well, I already drive. I know I can get to the doctor. Okay, not if you break your right foot. You can't drive. Okay, and as we get older, the ability to drive may become less. This could be a useful service for you, taking you to the doctor. Drugs are not covered on this plan, as I said earlier, but Part B drugs, that would be something related to, for instance, chemotherapy, or Part B drugs administered in a doctor's office, like injectable transfusion type, infusion type services, like Remicade, you pay 20% of the cost. Additional benefits, these are things that Medicare never covers. Medicare covered foot service. Well, Medicare covered foot service, but these are some of the additional things that you get. $50. Chiropractic care, $20 copay. Durable medical equipment like oxygen, wheelchairs, 15%. Hey, that's pretty good because Medicare is 20%. So we're saving you money there. Medical supplies and prosthetics, artificial limbs and braces, 15%. Again, all of this is 20% with your standard Medicare. Diabetic monitoring supplies, zero copay or 10 to 20% of the cost. Zero copay is using Humana's mail order service for the diabetic monitoring supplies like test strips, Lancets, things like that. Zero copay. So you could call the number on your Humana card to get that set up. Rehabilitation services, occupational speech therapy, $10 to $40. Again, associated with the hospital, more money. Not associated with the hospital, less money. Cardiac rehab, pulmonary rehab. Telehealth services. This has become very popular in the age of coronavirus, where you don't want to necessarily go into a doctor's office maybe. So you get on your telephone and you see your doctor on the telephone. Zero copay for your primary doctor, $50 for specialists, urgent care, zero, substance abuse or behavioral health services, zero copay. Continuing on down, these are some of the extras that come with the Humana plan. Corona testing, of course, that's pretty standard across the board. Everybody's going to get that. Travel coverage, any PPO doctor in the network nationwide. Over here, over-the-counter mail order catalog. Mail order catalog, the over-the-counter, aspirin, Tylenol, Band-Aids, toothbrush, toothpaste, bug spray, all kind of those over-the-counter things. There's a whole catalog that's in your book, full color, $75 per quarter this year. It's up. $75 per quarter. Use it every quarter. April, January, February, March is a quarter. April, May, June is a quarter. Every 3 months, make sure you max out and use that $75. That's a tremendous benefit to you. That's $300 a year of stuff that you don't have to go to the grocery store or the drugstore to buy. And make sure you get there's scales in there. There's digital blood pressure monitoring, all kind of things. Humana Rewards, Go 365. When you do your normal health screening and wellness activities, like going to the gym with Silver Sneakers, which there you go, Silver Sneakers is a part of the program with over 15,000 gyms nationwide that you can go to. Just call Silver Sneakers or go to silversneakers.com and find a gym near you. When you do those healthy screenings, your PSA test, your breast exam for breast cancer screening, all those kinds of things, you get points. Those points accumulate throughout the year. They expire December 31, but you can redeem those points for discounts to services, discounts to restaurants, all kinds of things in the Go 365 program. At any time of the year, you can call Humana and ask, where am I at? How many points do I have? What can I redeem it for? But I definitely encourage you to do that November, December, towards the end of the year, because you probably accumulated points and you got some free stuff that you maybe didn't even know about. Humana Well Done program. After an inpatient hospital stay or a nursing rehab stay, when you come home, they're going to drop ship to you 10 frozen meals. so you can recuperate without having to worry about cooking, or your caregiver maybe not have to worry about cooking so they can focus more on giving you care. So 10 meals, almost everyone I've ever talked to said they like the meals. And one person that I have talked to said they didn't, which actually makes me believe that they're legitimate, because everybody for a long time told me I liked the meals. They were great. So, but then somebody told me they didn't. So I actually honestly believe it more that the people were just being straight up honest with me, that they're really good tasting meals. This is a new thing for 2022, special supplemental benefits for chronically ill, worry-free meals. So if you have some of these concerns, chronic obstructive pulmonary disease, diabetes, congestive heart failure, depression, with the care management services, and you meet the program criteria, you can receive 2 meals a day for 12 weeks for a total of 168 meals. You can get a potential additional 12 weeks. There's no cost to participate. Authorization may be required. So again, call the number on the Humana card if you have any of these chronic diseases and you want to see if you can get some meals provided to you for free. Okay, call the Humana and say, hey, I've got congestive heart failure. Do I qualify? And see what you need to do to get those meals for free. Take advantage of every benefit that Humana is offering you guys. It's pretty awesome. So there's a provider directory on humana.com. This is all the legal disclaimer and a place to take your notes. So there you go. Let's stop this and come back to real world. Hey, we hope you've enjoyed this little quick presentation. We appreciate you. Thank you so much for being our members. You're part of our family now, and call us anytime. You should have a magnet on your refrigerator. If you don't call us, we'll give you a new one, 648-9984. Of course, it's area code 828-648-9984. We appreciate you. Look forward to talking to you again. Have a great day.